The criteria for epilepsy is more than one seizure. So you may have a single seizure, and there may be a cause for that. It may be metabolic, you may have a low blood sugar, it may be because of trauma, but that doesn't mean you have epilepsy. If you have more than one seizure that requires medication in an attempt to control it, then you have epilepsy. It is usually developmental, but can occur anytime during a patient's life. There are 2 million patients with epilepsy in the United States. It occurs often in childhood, and then for young adults, it is related mostly to trauma or to tumors, and then later on in our adult lives and as we get older to vascular disease. The most common condition that triggers a seizure may be stress, it may be caffeine, it may be alcohol, it may be a low blood sugar, and the seizure may erupt from that point. One of the common misconceptions of epilepsy is that it is just a functional problem. It leads to some social issues, but it's not dangerous. However, a patient with uncontrolled epilepsy has a high risk of death. Trauma and falls, as you might imagine, account for a lot of injuries, but the most common is called SUDEP, or sudden death in epilepsy. We're just now beginning to understand through research that it is the respiratory and the respiratory system's connection to cardiac function that is probably responsible for this. So medication is always the first line of therapy in somebody with epilepsy. The purpose of epilepsy surgery is to find an area of the brain that can be removed, that will not cause harm, and has a high chance of curing the patient. Every month, we see patients whose lives have been given back to them. An instance that stands out in my mind is a few years ago, a young woman who was working to be a judge and having terrible seizures from the frontal lobe. We put in electrodes to discover that the seizures came not only from there, but from the surrounding tissue, and we removed that lesion, and within a month, she was a different person and is now a very, very successful person and is very gratified by being able to control her seizures.